Hello, everybody. Dr. Dan Cartalicchio. Welcome to the Suburban Wellness Group podcast. I am your host today. We are very fortunate to have Dr. Anil Bajnath as our guest. Dr. Anil, thank you for coming on.
Thanks, Dr. Dan. Thank you for having me.
So, Dr. Anil, we were just talking about COVID. We're going to get into COVID. We were having a very interesting conversation. But I want to go over Dr. Anil's bio. Very, very interesting. Board-certified family physician, CEO and founder of the Institute for Human Optimization. And we're going to get into that. Graduated from the Ross University School of Medicine. Residency training at the University of Maryland, Family and Community Medicine. Went to University of Central Florida, majored in molecular microbiology. I'm a biochemist, and I think I'm afraid of molecular microbiology and medical laboratory sciences. Also has an MBA from the Keller School of Business. Some professional organizations, American Academy of Family Physicians, Institute of Functional Medicine, and the American Academy of Anti-Aging Medicine. Dr. Anil, welcome. Thank you for being on. Let's get right into our first question. We were discussing COVID before we decided to come on. So tell me, you're on the front line. Tell me about your experiences with COVID.
Thank you. Yeah, it's definitely present in the community still. And it's just been a very interesting time since it's made its way here and across the state of Maryland, and definitely seeing an uptick in numbers more recently again with anticipation of the second wave. And clinically, what we're seeing is people are presenting to me with maybe 1 to 3 days of some of the telltale symptoms of COVID, from respiratory signs and symptoms to some of the gastrointestinal issues to loss of smell. And the typical evaluation and workup that we're doing is going to start off with some basic blood chemistry and with a CBC and a BMP, and chest X-ray and additional COVID testing. And what we're seeing is, well, what I'm seeing clinically is individuals will have, that are suspected, will have a leukopenia, so a decrease in the white blood cell count below 4, nothing usually below 3.5. And within their differential, we'll be seeing a monocytic dominance. So there are different types of white blood cells, and they all play a different role. And, there's certain white blood cells that respond to tissue damage, inflammation, and bacteria. There's certain white blood cells that respond to viral infections. There's certain white blood cells that are more specific to bacterial infections. And the monocytes, I think, are one of those early indicators of infection, tissue inflammation, and they respond to that area and bring back information to the immune system for further reprogramming. But so yes, we're seeing that leukopenia with a monocytic dominance, and then I would get a chest X-ray and see some of the pathognomonic patchy peripheral infiltrates on chest X-ray. On physical exam, auscultation I'm not really hearing any of the rhonchus-like sounds consistent with like a bacterial pneumonia. Unfortunately, there's no clear-cut guidelines in regards to what we could offer in regards to specific treatments at this given point in time, because there's still no targeted therapy for it as yet, and it's just going to be more so trying to help facilitate a stronger immune system and reprogramming. And the question is, antibiotics or no antibiotics at that given point in time, do we handle it as a community-acquired pneumonia, or do we just treat it right now as a viral phase pneumonia? And so what I've seen so far is that, in the beginning, some practitioners are just getting individuals started on the community pneumonia protocol, whether it's doxycycline or a beta-lactam and a azithromycin combination. But I kind of feel as though it's a little bit early to just pull the trigger once we start seeing that kind of presentation to just immediately jump to the antibiotics, because I believe they're still in that viral phase of the pneumonia. And it's a secondary bacterial infection that we kind of need to prepare for thereafter. So, again, there's no clear-cut guidelines in regards to how this could be managed. I know more recently, dexamethasone, which is a steroid, has been shown to have some efficacy. There's some talks about inpatient heparin at DVT prophylaxis doses that are beneficial for some of the coagulopathies associated with COVID. And more recent research and evidence from that was published in New England Journal of Medicine. They recently demonstrated using what's called a genome-wide association study, a GWAS study, that there's specific molecular polymorphisms and hotspots that are associated with increased pathophysiology of the infectious process of COVID-19, and that is most notably blood type A individuals have more of a propensity of needing additional respiratory support. And, that ties back into some of my work that I did with Dr. Peter Diadamo during undergraduate studies. He's the blood type guy and mentor of mine. And, we know that blood type A individuals have a higher amount of circulating von Willebrand factor and factor VIII, which is very important in the coagulation cascade. That study also identified interleukin-6 as being upregulated in a lot of these individuals. And that is another very important pro-inflammatory cofactor that could trigger some of these inflammatory cascades and lead to what is known as an oxidative coagulopathy. That's a whole nother discussion, but it's just very interesting what we're seeing, clinically, and it is still very concerning. Yeah,
it still is very concerning, and we're talking about the second phase. What is your opinion on the second phase?
Well, it's really hard to say. By no means am I an expert. And some of the epidemiological data is showing that there's increasing rates and numbers of positive tests that are coming available. And there's all sorts of mixed messages that we're getting from the top down in regards to test, not to test, and, the sensitivity, specificity, and all sorts of stuff. So it's really hard to say, but what I'm seeing clinically, we're still seeing it in the community. And still recommending that to self-quarantine for 2 weeks, if it's suspected, and then also, if the individual gets tested and is positive, to definitely, maintain that self-quarantine until, they're retested and negative. So there's, again, no clear-cut guidelines in regards to return to work and how to manage it. So we're just sitting here kind of floundering with, what do we do? So it's just very interesting time.
Yes, and unfortunately, we are dealing with a novel coronavirus, and we don't know. And for all of my students at University of Bridgeport, Dr. Anil did mention sensitivity and specificity, which, Dr. Anil, they're having a tough time grasping. So tonight I'm doing a live lecture with him, and we're gonna be doing that. So you discussed about the immune response when it comes to the COVID. And we're going to have to build up our immune system because the vaccine is sometime in the future at this point, right? It's going to be sometime in the future.
So they say.
I've heard as early as November. Have you read that also?
Well, I have a good friend of mine from undergrad that is with a major pharmaceutical company, one of the biggest in the country, and he is their lead immunologist. And we had a very interesting conversation last week about vaccine development and where they stand on all of that and everything else. And, I know there was some talks about Mirena and, them rushing to receiving or having the vaccine ready, locked and loaded. And he was sharing with me some sensitive information that I probably shouldn't disclose right now. But I just question, when we're going to be actually receiving a vaccine for this and how sensitive and specific it is. Again, because in the field of virology, that there's this idea of genetic shift and drift and how that influences, the evolution of a virus over time and
Right.
could, influence how our immune system would get programmed to a vaccine. It's just so dynamic, and it's really hard to kind of predict that right now. And after my conversation with him, and he is very in the know and a part of that inside circle of big pharma and with the vaccine development, I just question when that's going to come about. And I also question the research that's being presented by certain companies that are claiming that they've made some positive segue in regards to coming up with a vaccine.
Vaccine, as you and I well know, will take year and a half, 2 years from start to finish, maybe a little bit more, maybe a little bit less, because you need to, make sure that it's an efficacious form of treatment, because if not, it's not going, it's just not going to do anything. That being said, what have you been recommending to your patients in order to help boost their immune system?
It depends on the individual. I am more of a vitamin kind of orthomolecularly oriented physician, so I place strong emphasis on making sure that simple vitamin D is optimized. As you know, there's this whole functional way of reading and measuring your vitamin D status. 30 to 100 is a range, but what is optimal? And most individuals that I'm seeing are well below 30 in their vitamin D status. And as we know, vitamin D is not a vitamin, it's a hormone. It binds to a nuclear receptor site and actually activates secondary transcriptional factors and so forth. And so I think starting off with, making sure that vitamin D status is optimized, vitamin D3 and K2, something that I personally take, and I tell them, look, I'm not prescribing this, but this is what I take as a frontline provider, dealing with this, because again, there's no guidance in regards to how this is going to affect downstream ACE2 receptors and whether or not this could have any bearing on a potential cytokinetic storm and so on and so forth. But, the vitamin D3, K2 is something that I personally take on a daily basis to help modulate and prevent any upper respiratory issues and help prime my immune system. In conjunction with zinc, 50 micrograms of zinc, and trying to get in 3 to 5 grams of vitamin C through nutrition, a little bit of supplementation, but primarily through nutrition, making some really great colorful smoothies and stuff like that to get all the different phytonutrients that I think are going to be beneficial to help ward off and offer antioxidant protection to my tissues. I also recommend stress reduction because, as we know, there's this psychoneuroimmunoendocrinology network, and how the stress of and mental burden of some of the issues that are going around right now will have a dramatic and direct influence on our immune system and how our cells will respond to that adversity if exposed to a coronavirus. So, it's going to be very important to be cognizant of your stress levels and how we react and respond to adversity in our environment, and how that's influencing our overall mindfulness and our coherence or heart rate variability, and what that looks like in regards to just the overall big picture of immune response. Personally, again, I recommend going outside, being in nature. Don't be scared of nature. I think it's okay to walk in a forest without a mask. You don't need a mask to walk, in a non-populated area. And I recommend just trying to be as much in nature as possible. Before we started recording, I shared with you my passion for being on the mats and training martial arts with Brazilian Jiu-Jitsu. And for me, having that cardiopulmonary exercise is very important to make sure that we're opening up those alveoli, which are like little grape sacs down in the periphery, to keep them well expanded, well oxygenated, and ready to help with build resilience towards this. Another big part of this, I think, is a microbiome. And as we know, 80% of the immunological program takes place in the gastrointestinal tract through the gut-associated lymphatic tissue, or GALT. And that immune system programming is very important to keep in check. So again, being cognizant and aware of the foods that we're eating and how that's going to influence the different microbes and help fuel and maybe downregulate some of the inflammatory processes, this could be very critical. So eating a healthy food, as much raw, not necessarily raw food, but plant-based raw food kind of diet as much as possible is going to be very important, I think, at feeding the healthy gut microbiome and giving them the prebiotic needed to fortify those cells, produce the level of mucin needed for that barrier protection. So it's a multimodal approach that I think needs to be taken. And it's not just with COVID, but with life as whole. In the big picture, it's very important to do these things, not just for now, but just as we age, So
I agree. And as you're talking, I have 1,000 questions, because you and I, as functional medicine practitioners, integrative practitioners, getting enough phytonutrients, diet is always number one. Yes, you need to supplement, but diet is always number one. Getting those phytonutrients in your smoothie, very important. Cardiovascular work to help boost that immune response is very, very important. Getting outside, getting in nature is very important. I actually took up running again during this time, and my son's a hockey player, and he and I are 10 to 12 feet away. He's always beating me, though, Dr. Anil. He's 12 years old. My knees aren't so happy, but just to get out there and to run in nature, it's therapeutic, mind, body, spirit, if you will. And we're talking the same language, and I also approach it the same way. Do you talk about getting a restful restorative sleep, 7 to 9 hours with your patients? I mean, that is vital in addition to, right?
Oh yeah, absolutely. And I show them two different ways that I gauge my sleep quality, and that's one through my mattress. I have one of those Sleep Number mattresses, which is amazing, and it actually measures your circadian rhythms and your heart rate and your quality of sleep. And then I also measure my sleep using an Oura Ring. Now, you don't need any of this technology, but it really shows and places emphasis on, cause and effect relationship and how that influences your chronobiome and your circadian rhythms. And if it's disrupted, and I could tell you from my own personal experience that if there's anything that's going to perturb my sleep for one night, it has a radiating effect for several days, and for which I'm playing catch up. So sleep is actually, one of the foundational things that I emphasize, for fortifying the immune system. Absolutely.
It's one of those lifestyle metrics that you talk about on your website. Now, you are trained conventional primary care, urgent care. What was the pivot? How'd you get into integrative medicine?
I actually, got into integrative medicine before medical school. So my story kind of begins in high school when I got a job working at Whole Foods Market at the age of 16 in the nutritional area and their little whole body section at the time. And was taught by some really outstanding physicians and authors and researchers that would come and lecture to us about the importance of nutraceutical products. Michael Murray, Peter Diadamo, all sorts of, amazing providers came through and trained us on the different products and how they work and the importance of, the spectrum of care. Because in a conventional practice, we're forced to, or we're working on a different side of the spectrum of this health continuum, where it's usually in a very reactionary like model, whereas we have so much time, beforehand to kind of modulate and prevent things. And unfortunately, you can't measure what you're preventing, but if we're always placing emphasis on health optimization, it's going to be better than trying to do this reactionary sick care kind of system. But so this kind of began for me when I was 16 years old, and started studying nutrition while working at Whole Foods at that time, and went out to a few amazing conferences where I was exposed to other, different schools of philosophy and thought process in regards to how to approach individuals on a holistic level, and studied some herbal medicine. And I actually, during undergrad, actually back here, my microscope that you see back here is
I was going to say, I do see the microscope.
yeah. So I actually, for fun, when I was 19, I got certified in a technique and purchased this microscope and started analyzing undenatured peripheral blood and looking at things on a qualitative cell dynamic level. And this technique actually led me down several different directions and influenced my direction in undergrad with molecular microbiology and medical laboratory science. I got trained on a conventional way of how to analyze a peripheral blood smear, which is a lost art in medicine. If you speak to any physician from that trained maybe around the 60s and 70s, they would tell you that historically they would make rounds and do their own peripheral blood smear and report that in morning rounds. And I feel as though this is almost a lost art in medicine at looking at a peripheral blood smear and being able to get a qualitative reflection of what's going on. And so for me, this is, not something that I like to advertise, because it is kind of a controversial subject in regards to what you're seeing and finding and analyzing. But this also influenced some of my undergraduate studies. During that time, I pursued a training with a European clinic called Paracelsus Clinic of Biological Medicine with Dr. Thomas Rao. And I was a recipient of a scholarship for which for 2 years I was fortunate enough to travel around the US to train with this clinic based out of Switzerland and learn their methods. The microscopy was a big technique in their practice, and study this whole system of European biological medicine, which is incredibly fascinating in regards to their holistic approach to everything. It's that's a whole nother podcast in regards to what we could go into with that. So that was a part of my foundation and training, and then that also led me down the road of studying functional medicine with some of the early Apex energetic seminars back in 2006. It was me and Datis Karazian. I don't know if you're familiar with Karazian's work, but
Datis and I, yes, we go back a long way. Dr. Karazian, so he's at Harvard right now, if I'm not mistaken, and he's doing research there, and Apex is one of the companies that I use, and I'm assuming that you use in addition to. So brilliant guy.
Oh man, he's like, him and Jeff Bland and all these minds are just, I just want to hear them speak. I just love listening to them speak. They are always filled with the latest research evidence and ways to kind of approach things. And, his training in functional neurology is just phenomenal. And, it's essentially, I was very lucky, to have him as a mentor for me, at a younger age, but he was, very stern. He's like, you need to hurry up, go to med school and get into practice. And I listened to his advice, and, I took a very non-traditional road through healthcare and my, training and everything else. But we're here now, and I ran into him about a year ago at one of the conferences, and we were just getting caught up and reminiscing. That was like almost, over 15 years ago that we're sitting down at these Apex seminars, just going over some of this information where we're at today. So I was just, very fortunate to have had these amazing mentors kind of guide me in my journey with personalized medicine. And here we are today.
Yeah, you and I have had the same mentors. At Apex, you probably had Dr. Tom Culleton and others as such. Yes, you're laughing.
The last time I hung out with Tom, was the Manny Pacquiao and Mayweather fight in Fort Lauderdale. He was doing an Apex seminar down there, and we all went out for the fight there afterwards. It was great. Yeah.
Yeah, I saw Dr. Culleton was one of my main instructors for the functional neurology going back probably around that same time, 2004, 2005, 2006. Interesting how you had this interest in, integrative medicine at a very young age. So you got the conventional primary care, as we said, you got the urgent care, and now you're working for, building your private practice, the Institute for Human Optimization. What type of practice is this institute? What do you do?
Oh, thank you for asking. It's actually more of a passion project for me in regards to connecting these molecular dots, so to speak. So, as I mentioned before, undergrads in molecular microbiology, and around that time, when I was going through my training, epigenetics was a big topic of discussion in regards to how the genes could be influenced and turned on and off, and various gene expressions and the molecular mechanisms behind that in regards to methylation, deacetylation, histone modification, and so forth. All big terms, and I apologize for your audience that aren't familiar with this, but it's really fascinating to see how we have the ability to influence and change certain gene expression. So for me, I've been completely fascinated by that concept, and I'm actually really excited with the latest advancements in molecular diagnostics that we can actually measure your epigenetic gene expression in your biological age. And so what we're doing is a data-driven, scientific-based approach to wellness, where we're looking at an individual from their genome to phenome, and I think, and using this information to make very informed decisions and targeted interventions needed to not manage disease but optimize health. And and the thing is, I'm very selective with who I'm working with and who I kind of allow to engage in this therapeutic relationship with. You have to be motivated and have that desire for self-actualization, where you want to know and translate your book of life, and what those 23 chapters of your book of life are saying and what they mean and how we could use this information for self-empowerment. So, the Institute is essentially, again, the passion project of connecting these molecular dots, where we start off with your genetic blueprint, and we use, SNP analysis, single nucleotide polymorphisms or single gene variations, to look
What type of testing is that called?
In terms of the genetic analysis.
Right. What is that the MTHFR test you're talking about?
Well, MTHFR is just one polymorphism out of
Right.
thousands that you could be looking at, but this is more of a genomic analysis. So there's a difference between genetics and genomics. And genetics, medical genetics specifically, is going to refer to more of the inborn errors of metabolism and very obscure disease conditions, and such as cystic fibrosis, with the with the transmembrane dysregulation, looking at PKU, and some of these other inborn errors in metabolism that lead to a significant disease pathology, versus now looking at things in regards to your overall genomic blueprint and translating this information in regards to how you could have, for example, the MTHFR polymorphism, and that influence methylation patterns in your system, and could have a effect on a biomarker called homocysteine, and making some of those connections. But it also could go into various metabolic pathways in regards to your cytochrome P450s and hepatic detoxification, and influence some of the pharmacogenomics in regards to what kind of drugs are being metabolized, how they're being metabolized, and looking at drug-drug interactions, drug-nutrient interactions. We can look at it from a nutrigenetic standpoint and see if there is any additional polymorphisms in vitamin A or beta carotene metabolism. One of the more interesting applications that I like to look at is actually, I'm in the process of completing my board certification in lipidology, is looking at the lipid metabolism dynamics and seeing the translational process between what we're shoving in our mouth, what the biomarkers are saying in regards to advanced lipid profile, and what your blueprint is saying as well, and connecting those molecular dots and seeing translationally, if you have various polymorphisms and metabolism of various fats and carbohydrates, how that influences the lipid dynamics once we get a advanced profile.
It's very important, and it's something that is very interesting to me because a large part of my practice is dealing with lipids, and it's very important. For me, when I was 37 years old, I had a heart attack. So that was my pivot, and that's how I got interested in this. So that's a very interesting approach that you have to the precision medicine. Is there anything else you want to add with that?
Well, use a key term. Precision medicine, I think, is going to be widely adapted to primary care once the, Moore's law is further in full process, because, as you know, the cost of genetic testing went from millions of dollars down to, you could get, I think, whole genome sequencing now for $300 to $500 for some labs.
Right.
But right now the NIH has a very large clinical study called the All of Us Initiative, and the NIH is actually pioneering some of the major research in this area in regards to further making and connecting those molecular dots and defining the precision medicine initiative, which is incredible because, they define essentially the precision medicine as an emerging approach for disease treatment and prevention that takes into account individual variability in genes, environment, and lifestyle, right? That's huge. Genes, environment, and lifestyle. That sounds like functional medicine to me. But I'm just saying, it's that targeted approach where, we're using this information to make informed medical decisions, put together tailored treatments, and also tailor all this information to the individual, no longer using this one-size-fits-all kind of model. We could get into, some of the science and evidence behind that, but it's a philosophical shift in certain respects from what we were taught in medical school in our trainings in regards to looking at what we call evidence-based practices, where we're always looking for that large N value. The larger the N, the stronger the power and clinical significance of, how this is going to be translated into population-based medicine. But that's great if you're doing certain things, but when you're sitting down with the individual that is, not, wasn't represented in that clinical study, maybe they come from a different ethnic background or something to that effect, and we're not taking into account, again, their pharmacogenomics and cytochrome P450s, that's going to shift the clinical response and outcomes to what how they're going to respond to drugs. And, and that gets back into the number needed to treat, and that number needed to treat, you're probably going to mention this in your biostats lecture to your students tonight.
Dr. Anil, what I'm going to do is I'm going to put this up, if it's okay with you, I teach at University of Bridgeport. I teach at the Nutrition Institute, and I'm going to have them listen to our podcast because everything that's going to go on tonight is what we're talking about. So I think it'll be interesting for them.
Well, and it's very important to look at it in regards and within the context of how we practice medicine today, because, there's an incredible article that came out in Nature in April 2015 that was looked at what they were calling, time for, one-person trials, or this N of 1 approach to clinical medicine, because what we're largely doing is trying to use these population-based studies for the individual and leveraging this number needed to treat. And some of these individuals aren't, 1 in 10, 1 in 40 are getting clinical favorable benefits, but enduring all the side effects of some of these medications, with for example, statins, which is so high. And I'm not anti-statin, but I am, I have so many patients that are incredibly statin intolerant. And, they have what's known as a SLOCO1B1 polymorphism and aren't able to tolerate and metabolize the drug efficiently. So they develop the, the myalgias and all the other increase in LFTs and all that stuff. And it's just, it's downstream. And, the question would be, what if we got them at goal, according to the ACC AHA guidelines, with their lipids using nutrition? And, more mindful nutrition. And again, it requires a highly disciplined individual to want to pursue that, and not have the typical screw you, fix me attitude in regards to how
Right.
some individuals are with their healthcare. They're like, just give me a pill, Right. So again, it's a different mindset. It's a different buy-in. And, there's a lot of cognitive dissonance in on a patient level, on a practitioner level, in regards to, when faced with evidence, how motivated they're going to be in regards to making those individual changes. So tying it all back in, I think that, this N of one approach to healthcare is going to be very important to look at moving forward, because, and especially in clinical studies, because, we're conducting these clinical studies on individuals that qualify for it, and what buys you a qualification could be a symptomatic presentation or an actual biomarker or something to that effect, but we're missing the overall milieu or environment that could be influencing that: nutritional status, stress status, sleep status, cytochrome P450 status. All those things are very important at looking at when conducting these clinical trials. So I'm excited for the future, and how this information is going to be translated into highly individualized, personalized care.
I agree with you. And I think what makes your practice really great, like our practice, is that you are the traditional, conventional primary care, and yet you can add in the functional medicine. And that marriage, I think, is very, very powerful for positive outcomes with patients, where I do the clinical nutrition, functional medicine in our office, and then the integrative internist does the conventional primary care. And we just get really good results. We're equally as excited. I can hear the excitement that you have, for the future of healthcare. And this is the way it's going. Now, I have a question here for you, because you've written a book, Longevity Equation. All right, that's great. I love the title, Longevity Equation. Tell us about the book. Listen, we're going to have you back on, Dr. Anil. I want a copy of the book when it's out, so I want to read it, and then we're going to go through it with a fine-tooth comb. This. You have a ton of information. I love this. Tell us about the book.
Thank you. It's actually, again, a passion project. I've been at this for a very long time, and I've been very privileged to have here and study with some of the most brilliant minds in the world. And so it's basically kind of how I synthesized all this information over the years, and connected some of those molecular dots, and tried to put it together in a comprehensive format so that we could achieve better longevity. For me personally, it's highly my longevity is motivated to not just be disease-free, but also have, the ability to train martial arts and jiu-jitsu into a later age, hopefully injury and disease-free, and with a similar tenacity that I had when I was in my, teens and 20s. Needless to say, recovery is definitely taking a lot longer these days and everything else. But, it's for me, just looking at that overall overarching theme of longevity and exploring my additional training in anti-aging and regenerative medicine, and really looking at what's mediating some of those biological aging processes. As you may know, there's 9 hallmarks of aging, and those 9 hallmarks are pretty clearly defined, and they influence basically that pathophysiological process as we move forward in age. And essentially, aging is the degenerative change that could occur as a result of this accumulation of genetic and cellular damage due to a loss of adaptive capacity to repair itself. So if we're constantly being inundated with different, what I call signals and inputs, that's influencing your, on a DNA level, influencing your DNA expression, it's going to be very important to identify those stressors, signals, and inputs. So there's different longevity blocks that we have in there, and one of the first sections is looking at the chronobiome, which is a very fascinating area of research right now, and looking at your chronotype and taking a deep dive into your circadian rhythms and how that is very important for regeneration and repair, and making sure that we're able to help facilitate these patterns and rhythms of life gracefully, so that we could move forward and with minimizing disease, because some of these disruptions in the chronobiome is linked to, name a disease, any disease, it's there. And additionally, nutrition. Nutrition is such an important fact. This, teaching clinical nutrition. We have this signals and inputs from the phytonutrients or trans fatty acids communicating with our DNA. And that influences how our genes are expressed. And, so essentially the food is information that has direct communication with our DNA and gene expression. And depending on what kind of signals and inputs we're feeding our cells in our body, it's going to influence what kind of repair and response they're going to have. If you're consuming a high amount of fried food and trans fatty acids, that's going to increase your membrane lipid peroxidation and cause a lot of not only vascular stress, but cell membrane stress. So exploring the nutrition, exercise and movement, and how to help facilitate, increasing neuroplasticity in the aging brain. Ultimately, it's about promoting a great brain health so that we have the neurocognitive capacity to maintain its sharpness and acuity as we get older. And there's enough things that are challenging that and threatening to our aging brain, unfortunately. So the book, again, is exploring some of these different ideas and at the research and evidence that we have in regards to how our genes are being influenced and how it influences our expression, and how we could use this information to code for resilience, and the tools and resources that you could do to almost biohack your system. So it's right now it's in production, and we're hoping for a release date here in the next couple of weeks. It's going to be released from Angel Publishing in Baltimore, Maryland. And again, it really takes a deep dive at this idea of a biological aging process. And one of the things that I like to emphasize is, our biological age is completely different than our chronological age. And conceptually, we really need to acknowledge that presence because, you might be, 25 years old, but have the vascular system of a 37-year-old because of different stressors and trans fatty acids and so forth that influence our epigenome and influence how that's being expressed.
Yeah, this is extremely important, listeners. I mean, this, Dr. Anil is giving you, just so much fascinating information, and where is medicine going with nutrition, with different types of supplementation, because in school, in chiropractic school, I think we had one nutrition course, and it was more of a biochemical type of a situation. And I'm sure yours was very same and similar at that particular time. And as we grow as physicians, we learn different things, for the benefit of our patients. Now, that's a great, I'm going to wait a couple of weeks to put this podcast out, because I want to be able to put in the link to purchase the book. Okay.
Thank you.
That's what we want. And I want everybody to purchase this book. I'm getting the book, and I'm going to read it. And then I'm going to have Dr. Anil back on, and we're going to discuss, each and every chapter. So it sounds like you got a lot of projects going on. What other type of projects do you have going on?
I have a nutraceutical formula that I'm working on.
Tell us about it.
It's, it ties back into one of those hallmarks of aging, which is cellular senescence. And cellular senescence is essentially once a cell hits its endpoint of mitotic potential, right? What's known as a Hayflick limit. There's a whole story behind this, but essentially, you know, a cell has X amount of ability to undergo cell division. And once it hits that limit, it's said to be in cellular senescence. And so it's basically an old, worn out cell. Now, this cell has two faiths. It has the ability to be removed from circulation through the immune system and various molecular tags. It could, if it's a red blood cell, it could be removed by Kupffer cells in the spleen. If it's a damaged neuron, or it could be removed by neuroglial cells in the brain. So there are different kind of macrophages that are around, and they eat up and remove these old cellular senescent cells. Additionally, these cells could be undergo what's called programmed cell death or apoptosis. But sometimes these cells evade those two faiths and just persist in circulation or in its environment, and evading those two removal techniques. And when these cells persist, they actually carry with it what is known as a SASP, a senescent-associated secretory phenotype. And this SASP is actually kind of poisoning the well, so to speak, in regards to releasing different interleukins and chemical messengers that could actually accelerate the biological aging process of all the cells around it. So it's actually a very important target for a lot of drug interventions and drug development in pharmaceutical industries. But essentially, we're looking to target various pathways and mechanisms that are going to help modulate that pathway, and hopefully, when used with other techniques, nutritional techniques, will help the body help facilitate a biological process known as autophagy. So autophagy is in Latin translates into self-eating, and the Japanese Nobel Prize winner in 2016 mapped out a lot of those different pathways that influence autophagy. And we know that autophagy could be induced by different drugs, different nutrients, different signals and inputs, again, intermittent fasting, and hoping to help facilitate a downregulation of some of those sterile inflammatory processes. So that SASP that I was talking about is actually priming your body with what's called sterile inflammation, which is essentially an inflammatory process that is not triggered by an infectious process or anything like that. It's just this low-grade chronic inflammatory cytokinetic dominance that actually is involved with some of the COVID, is postulated to be a part of some of the COVID cytokinetic storms, is having that high low-grade chronic inflammation. So again, it's looking at modulating that cytokinetic milieu. It's looking at helping facilitate autophagy and support some of those biological processes.
Yeah, I love this. I love this conversation. And you are a Renaissance man. You have everything going on. You got some Brazilian jiu-jitsu. You have you're a practice. You got a book coming out. I love this. Now we're coming upon the hour, and a couple of more questions. One more question, actually. Anything else you want to discuss? Anything that you want to discuss?
Thank you. I just want to say thank you for everything that you're doing and having me on. And, in regards to everything, it's just, where do we begin with that? It's just such an open-ended question. And I think that,
right.
Especially where we're sitting here today, towards the end of June 2020, and everything that's going on in society, I think, my big message is just going to be just love, just putting out good love, good intent, and strengthening our community. And, just
important, very important.
The reason why I got into healthcare, with your original question that led us into this conversation was, I saw the value of promoting health and wellness within my community in South Florida at a very young age, and what that translated in it's a rippling effect. So I think taking care of ourselves and others and promoting, a sense of community and love and respect and just being selfless right now is just so important. Everybody's got an opinion and is trying to push an agenda. I think it's good to just, keep your mouth quiet. I want to say something else, but keep your mouth quiet. Right? Be a good listener.
Right.
Be a good listener, right? And offer empathetic love and respect to everybody, because you don't know what anybody's going through right now.
Right.
And there's so much toxicity environmentally, socially. Social media is all full of stuff. And it's just, right now, I think it's going to be very important to surround ourselves with positive, good energy, cultivate good energy from within, practice on our mindset, our words, our actions, our behaviors, not all this chaotic BS that's going on right now. We need to live by example and try to be better individuals for ourselves and our community as a whole. And, that starts off with love and respect. And just if we always operate with love and respect, I think we're going to have minimal conflicts or issues,
Right. And what you're saying is so true. And be a better person, come from love and respect, keep your mouth and listen to the other person. And then when it comes time for you to talk, they'll do the same, so that there's this as opposed to this. And I preach this to my son. And it's great that you brought this up. I preach this to my son all the time. And he's a quite amazing little boy because of that. And I think that's very, very, very important. Dr. Anil, how can people get in touch with you?
Oh, yeah. Well, there's my website, IFHO, the Institute for Human Optimization.org, IFHO.org, or anilbajnath.com. Send you links to it. So when you blast this, you'll have all of that.
Absolutely.
We have our clinical office in Arnold, Maryland, Columbia, Arnold, Maryland. So we're going to be seeing patients there. So if you like to schedule an appointment in person, I'm going to have a bunch of awesome tools and gadgets that we could have fun with. Again, I'm exploring this whole institute is for me to connect these molecular dots so that we could work towards self-actualization. And so we could do things either virtually or in person, whatever works. I just want to help those who are receptive to the message and join you on this journey towards self-actualization and be your health intelligence partner.
For all of the listeners, you're listening to somebody that's very, very special. I recommend Dr. Anil 100%. Great guy. You can see the passion. You can see the knowledge. You can see how he has that love and respect and how he wants to help everybody. So not only purchase his book, which I'll give you the link to, I'll put this up in 2 weeks, but reach out to him. And I have learned so much respect as a physician, as an individual, as a colleague. Thank you very much. It has been an honor and truly an honor and a pleasure to have you on. Thank you. And once that book comes out, I want a copy, and we're going to have you back on, and let's go through the book. I want to thank everybody for listening. I know there's a ton of podcasts that are out there, and we bring the best of the best of the best, and you can see that Dr. Anil is that truly. Thank you, everybody, and we'll talk to you soon. Take care.